Good afternoon and welcome back to Grand Rounds. Today it's my pleasure to introduce Thyra Cox and Elizabeth Burkland. Thyra holds a Master of Science in Nursing and is also a certified diabetes care and education specialist. Elizabeth is a registered dietitian and also a certified diabetes care and education specialist, and they're both members of the incredibly helpful Diabetes Education Department here at MGMC, and we're very appreciative of the fact that they've accepted our invitation today to provide us with a review of treating prediabetes. And please join me in welcoming Thyra and Liz. Thanks.
Good afternoon. So Liz and I are both very excited to be here to tell you more about our programs that we run here at the Diabetes and Nutrition Education Center. So I'm going to tell you a little bit about our agenda. All right, so the things that we're going to cover today, we're going to start out with just talking a little bit about what is the National Diabetes Prevention Program. Then I'll go into more details on who qualifies for the National Diabetes Prevention Program, and specifically the two different sort of arms of the program based on insurance coverage. And then Liz will take over and talk more about our statistics and data for Mary Greeley's program, what's new in our program, and give you a little bit of a profile of the types of patients that do very well in this program, and some personal stories of some of the patients that we've taken care of and had in our program who've done very, very well, and then talk a little bit about how to refer to the program. So what is the National Diabetes Prevention Program, aka the Diabetes Prevention Program, or as we lovingly call it here at Mary Greeley, the Prevent T2 program? The National Diabetes Prevention Program is a lifestyle change program that helps participants who are at risk for type 2 diabetes to make sustainable, healthy lifestyle changes and achieve weight loss. The program can be offered virtually, in person, and through distance learning modules or modes. It can be offered in community settings, and it can also be offered in clinical settings like we do here at Mary Greeley. It's delivered in a group-based format, which is one of its keys to success, and it takes a pretty significant commitment on the part of the participants because it does take 12 full months to complete the basic part of the program. A few more details about the Diabetes Prevention Program. The program oversight, recognition, and quality assurance occur through the CDC. The Diabetes Prevention Program is supported by the American Medical Association. So in the Diabetes Prevention Program, trained lifestyle coaches facilitate group sessions of 8 to 12 participants. And this is part of the richness of the program, is having those 8 to 12 participants meet with this lifestyle coach. In our program, we use clinicians. So we have 2 registered dietitians and 1 nurse who are all lifestyle coaches, and we run this program and work with the participants. Our program follows a very specific curriculum, and we must meet national standards. And some of the topics that we cover in our curriculum include getting active, eating well, meal planning, getting support from friends and family, sleeping habits, coping skills, and stress reduction. We also add a few fun things into our curriculum, which include grocery shopping. Well, that was before COVID, we did that. We actually would take a trip to the grocery store and talk about how to grocery shop. And we also do a yoga session with our participants. Emphasis in the program is on empowerment through personal goal setting. So one of the things we really work with people on each week when you meet, or every other week when you're meeting, as the time goes by, you meet less frequently. We really stress setting goals that are attainable and realistic, and that allows the person who's involved in the program to slowly make changes over time that really cement those changes they need to make overall to be successful and be able to maintain the changes that they've made. Program providers are required to submit data on participant outcomes. So this is one of the big things that I think causes the diabetes prevention program to be rather unique. Every participant, when they come in to each session, whether it be a virtual session or a face-to-face session, must be weighed, and then they have to tell the lifestyle coach how many minutes of activity that they were able to attain that week. And then the lifestyle coaches document that in the medical record, and then the program is responsible for keeping a record of those 2 data points and then have to submit that data to the CDC on a schedule that they give to us. And that's what allows our program to be recognized by the CDC. And it's not a small feat to be able to do that on a consistent basis. Our program has been recognized since we first started, and we've been able to sustain that full recognition throughout the history of our program. So we're pretty proud of that, actually. We always sweat it a little bit because the data always looks kind of funny when you turn it in, but we've been able to sustain that throughout the program, and we really do feel like we know that means that we are doing a great job of providing the program to the participants. So throughout our program, Mary Greeley has hosted 17 cohorts, or what we call groups, and we usually start a new cohort about every 3 to 4 months, sometimes a little closer together. So for example, we just started a group in January, and we expect to maybe start another one in late February. And we try to offer the groups at different times and on different days of the week so that we're able to really meet the needs of the participants. So we sometimes have had groups that met at 7 a.m. in the morning. We've had groups that met in midday. We've had groups that met at 5 p.m. The diabetes prevention program is really supported by strong research. So this program came about because the CDC wanted to find out what they could do to try to bend the curve related to the large increase in the number of people in the United States who had type 2 diabetes. And the trials that they ran initially showed some amazing results. And you can see from what's on this slide some of those early results. So when they looked at about 3,000 adults who were at high risk for type 2 diabetes in a 3-year follow-up study, they found that the lifestyle intervention, or the diabetes prevention program, what it was called eventually, actually reduced the incidence of type 2 diabetes by 58% compared to the placebo. If the participant was given metformin, the incidence was reduced by 31%. And the amazing other statistic they found was that if they had participants who were 60 years of age and older, they actually could reduce the incidence by 71%. So one of the reasons that the Medicare Diabetes Prevention Program was rapidly taken from research to a benefit for Medicare recipients was because of that statistic of 71%. They found that data, and then within 2 years, they had a program that had coverage for the beneficiaries. And that is not a small feat in the Medicare world, as most of you are aware. Another large study of about 15,000 participants, and this was not people who were in an actual CDC study, but actually people in real world, I call them real world participants. So people who were enrolled in programs like the one we have at Mary Greeley. These were people who were in programs across the country, and the study looked at how did those people do. And they found similar results. They found that 35.5% of the participants 4 years after they had been in the program had achieved the 5% weight loss, and they had achieved the 152 minutes of activity per week. And that data was interesting because they also noticed something that we were able to, we actually noticed the same thing, but it supported what we had noticed, which was that the more sessions people attended, the better they did. So this program, because it's a very intense program and requires a lot of commitment on the part of the participants, this research really supported that you really have to work hard to make sure that people who enroll in the program continue to come week after week, or when you switch to every other week or monthly, that you don't let people just drop out of the program. People who came the entire 12 months were the people who were able to meet those targets and really were able to sustain and maintain the changes they made. So we made some tweaks to our program because of that. We added extra sessions, and we also kept our program, our sessions closer together for a longer amount of time, and we feel like that has driven part of our success. And then lastly, I'll talk a little bit about the requirements. So we have kind of two different pools of people when we look at who's eligible for our program. The first group is people with private insurance or those who may choose to pay cash for the program. This is probably one of the areas that Liz and I have found to be a little disappointing. We initially thought that once Medicare had approved coverage for this program, that most private insurance companies would then begin to pretty much holistically across the board provide coverage for the diabetes prevention program. At least in the state of Iowa, this has not really happened. What's happened is more that individual companies or employers have said, we want this to be a benefit for the people who work for us, and they have allowed coverage for it. So for example, Mary Greeley has coverage for the program, McFarland Clinic has coverage for the program. There's a few other employers in our area who have provided coverage, but for the most part, we haven't seen that happen. So we do allow people to pay cash, and we do offer a cash discount to people. So the cost is fairly reasonable for most people to be able to afford the program. The cost is $500, and then they do receive a cash discount. And most people, when they figure out what they actually get for the program, are actually more than willing to pay for the program themselves, because it is a long program with a lot of intense help. So to be eligible for that type of scenario, people have to be at least 18 years of age. At this point, the CDC has been doing some work to look at whether middle school aged and teenagers, they've done some work on figuring out if they can adapt the program and possibly come up with a program for diabetes prevention for that age group. But at this point, we do not have any eligibility for those individuals. They must have a body mass index of greater than or equal to 25 unless they're of Asian descent, in which case they qualify at less or greater than or equal to 23. They cannot be pregnant. They cannot have a diagnosis of type 1 or type 2 diabetes. They may have a lab test that qualifies them, which would be a hemoglobin A1C of 5.7 up to 6.4%, or a fasting lab of 100 to 125 milligrams per deciliter, or if they've done a 75-gram glucose load challenge test with a 2-hour plasma test of 140 to 199 milligrams per deciliter. Any of those would be supportive evidence that they have prediabetes. If they have a clinical diagnosis previously of gestational diabetes, then that is a qualifier. And also they can take a prediabetes risk test, and that test, if they have a high risk score, that would qualify them as well. And that prediabetes risk test, as well as the references for all the studies that I cited, are listed on the last slide. For our Medicare beneficiaries, it's a little bit different. So for Medicare recipients, Medicare has a little stricter requirements. It is a one-time benefit, so they can only take advantage of the program one time when they are a Medicare beneficiary. But it is covered 100%, which is a great benefit to people. And we really like to remind people of that they do have no cost that they have to put into the program. They must have a documented blood test in the last 12 months showing one of those same blood values, the hemoglobin A1C, fasting plasma, and 2-hour plasma glucose. It cannot be self-reported, whereas that can be something that people with private insurance or cash can tell us about. Their body mass index would be the same qualifications as our previous group of people, with 25 being the cutoff for most people, and 23 or greater for people of Asian descent. And then they can never have had a type 1, type 2 diagnosis, and also they cannot have end-stage renal disease as a diagnosis. And again, the other qualifier is that they would never have participated previously in a program. All right, so I'm going to hand it over to Liz and let her fill you guys in on some of our data.
All right, so I'm going to talk about our program specifically at Mary Greeley, starting with our data. As Thyra said, we're really proud of how our data has met the CDC guidelines from the very beginning, and we've been running this program for about 4.5 years now. We do submit our data every 6 months, and our most recent submission happened in September of 2020. So that included participants who ended their program between March 2019 and September 2020. So kind of right as we were hitting the beginning of COVID, these participants were ending during that time. We still met our goals, though, so we did still achieve a 5.8% weight loss for our groups, and our average activity minutes were at 257 minutes per week. That 257 minutes per week is very normal for our submissions. We're always right around 250 minutes, which is 100 minutes more than what is even required for the program. And I think that just goes to show that as people are getting more active, they're enjoying that activity, and we really do try to make that activity goal achievable for everyone in our program. A big question that I usually get when I present to, when we present to physician offices or even to other hospitals or communities who are considering starting their own program is, how do you get people to continue in a program for an entire year? How do you get that commitment out of them? They're worried that they won't be able to achieve that. And honestly, our retention has been really good throughout our programs. We usually have 8 to 12 participants in each group, and I generally expect to lose 1 or 2 people, and those people usually drop out within the first month. They usually just find out that the program is not quite the right fit for them. Maybe they don't enjoy group settings, something along those lines, but an 80% retention rate is very normal for us. Our median age in our entire program is around 60 years old. It does range from usually 40s all the way up to 80 years old, but our median's 60. And if we tease out the Medicare population within our groups, the goals are very similar, or our achievements are very similar. So a weight loss of 5.1% and an average activity minutes of even a little bit more, 290 minutes per week. And I will explain why I think that is here in a minute, but even with Medicare population, we're getting a lot of activity minutes, and the median age there is 68 years. So now I'm going to walk through a few things that are brand new with our program. We presented on this a couple of years ago, and there have been a lot of things that we have updated and changed here recently. One of the big ones is, of course, that telehealth option. When COVID-19 first started and those restrictions started back in March, we immediately switched over from in-person groups to completely WebEx based groups. So they are still live sessions. People are still asked to come at the same time each week and to join together at one time, but it's all hosted on WebEx, which, if you're familiar with Zoom, is a very similar format. Retention was something we were a little bit worried about, but it has been equal, if not better. We're not quite a full year into the telehealth version of the program, but so far we have not had a lot of people complain about the WebEx version. We've still had really great conversations, and because it is still a live session, group interaction is still good. We are able to see each other through video. Most people are able to get their video cameras working, so we still have that kind of face-to-face interaction. And I also think for like our working population, it's been a little bit easier for them to attend sessions throughout. And even like our Medicare group, sometimes we worry, what if they're not good at the internet or something like that? It's not been a problem getting people signed on to these sessions. Sometimes sometimes the first 2 sessions are a little shaky, and then they figure out the process, and it's gone really well. I also think it's gone so well because it's sort of a social support piece during COVID. A lot of my participants are talking about how much they enjoy talking to other people during this time, or just connecting with others, and how proud of themselves they are that they've been able to continue to keep their health top of mind during a really high stress time, during a time when it would have been easy just to kind of hole up in their homes and put their food and activity goals kind of off to the side. So it's still been going really well. Of course, people, if they don't have the ability to use a webcam, they can call in through the phone, although the webcam is preferred because it helps with that connection piece. And then we are also sending out the handouts each week through email. Those are PDFs, and if they prefer to have those printed, they don't have a printer at home, they can stop up in our office quick and pick those up. We'll still provide that for them. Weight and activity minutes are reported through email. Medicare requires an in-person weight at the first session, so anybody with Medicare is stopping up quick to do a weigh-in at the beginning, but then after that, it can all be done through email. Another new thing since our last presentation is that we did gain that Medicare recognition. We became an official Medicare DPP site in 2018, which means that anybody who has Medicare and meets those requirements that Thyra walked through has 100% coverage of the program. They not only have 100% coverage of that 1-year program of the original study, they also have a year of monthly follow-up sessions to help with maintenance to really make those changes concrete, and we're continuing to check in a group setting month to month. We are very hopeful that Medicare will continue to allow sites to offer this service via telehealth. They haven't completely said yes or no, but it has been it's been successful. So a lot of people in our area think that it will be continued beyond even just COVID restrictions. And the next thing that we're really excited about is our Fresh Try Companion app. Our program did qualify to participate in the Fresh Try study. It's a CDC-sponsored study, which is a new phone app that will help us to continue to communicate with our participants outside of just those 1-hour sessions. And it's really all about habit formation. So they call this a neuroscience-based habit formation app that helps to capture insights, reframes perceived failures, and celebrates efforts. So they really have focused a lot on creating an iterative mindset for people, which is just a resilient way of thinking that empowers people to set goals that are not necessarily performance-centric or so tracking focused. So it's really focused on creating habits that people can continue lifelong. Every goal is not actually called a goal, it's called a try. So the whole point is to set your intention, something that you're going to try this week, and it takes away that pressure of a pass fail. Normally we would check in, how did you do with your goal this week? Did you meet it or did you not? And every time that somebody feels like they did not meet their goal, it sort of sets this negative feedback loop that makes it harder to continue to work towards building that habit. So with this app, it's really all about trying new things, having that open mindset to say, okay, this didn't work quite the way I thought it would. How can I adjust it so that when I try again, I will be able to meet that goal? It also allows the participants to have some more one-on-one communication with the coaches. They can instant message the coaches outside of that 1-hour time frame. So it does give us a little more opportunity to interact with them. Oh, I should also share with this app, it's starting in January, so we haven't even started it quite yet, but it is rolling out in January, and it is available for our participants for 1 year and potentially even longer, but that initial study is lasting a year, so we will be participating in that. We've also rolled out a slightly altered version of the diabetes prevention program for moms who had gestational diabetes during their pregnancy. Because women who have a history of gestational diabetes automatically qualify for this program, and we know that they're at higher risk of developing diabetes even sooner in life than maybe typical, we really wanted to get this population enrolled into our diabetes prevention program. The struggle has been that anybody who's been a new parent knows that your life is very busy when you have a brand new baby at home and oftentimes other kids. This is usually a working population as well, or just a very busy population. So to have these moms commit to a 1 hour weekly session has been very difficult to do as far as our in-person groups has gone. So we took the original diabetes prevention program and we recorded each session and put it onto a video on an online platform where moms who are interested in enrolling can log into, and it's sort of a do it at your own pace. They only get one module released to them each week to prevent that overwhelm when you open up 29 modules at once. They're just getting one at a time delivered to them. And these videos are shorter, so they're usually like 15 to 20 minutes long at most. Some of them are even a little bit shorter than that, so they can kind of watch it while they're doing other things, or if they have 20 minutes at the end of the day to even log into their phone and watch it, they can do that. There is an app that they can use to view all of these videos. The videos are all based on the original curriculum, so we still cover stress management, healthy eating, activity, finding social support, all of those things are still covered throughout, but we did modify all of the stories to be more based on the life of a mom, and we modified some of the activity suggestions from going to the gym for 30 minutes. Now we're saying, well, maybe we'd go for a walk with the stroller, or here are some online videos that you can do that are mommy and me, so you can kind of incorporate this with the kids as well. We also talk a lot about time management and meal planning with kids involved, looking at maybe some of their texture preferences and that sort of thing throughout those sessions. So it really has been the original nuts and bolts of the program, but modified to fit more of a mom's lifestyle. There is a private Facebook group that they are invited into as well. So these are only people who are currently in the program or have participated in the Mom Post program, invited into this Facebook group. And that just kind of allows for that group interaction, that group support. They can ask questions in that group, and it's a private community, so it's a pretty small group of women in there. And of course, we've got a couple lifestyle coaches who are moderating those posts, making sure that everything is still flowing well, and we're posting extra wellness tips and that sort of thing in that Facebook group. The goals we changed slightly, although they are still very similar to the original program goals. So the weight loss goal is to either achieve pre-pregnancy weight or to achieve 5 to 7% weight loss. So we leave it up to them to set their own weight loss goal with those suggestions. And then the activity is the same. It's 150 minutes of moderate activity each week. So you might be wondering who would do well in this program. We have found over the last 4 years that some people really do well in this program, and others just are not a good fit, or those 1 to 2 people who tend to drop out. So we found some similarities. First and foremost, the Medicare population does an amazingly well in this program, even during COVID and telehealth, as I explained. They're some of the most engaged and motivated people in our program. I think part of it is that they have more time, or maybe it's just that flexibility with their time to achieve those activity goals and to achieve their individual goals that they're setting throughout. But also, just based on our conversations in the group, a lot of these people have big goals for their retirement. You know, they don't want to just be sitting around during their retirement. They want to either be spending more time with their grandkids, be like crawling on the floor with their grandkids, or they want to be traveling with their spouse and be in good enough shape to do those walking tours and that sort of thing. They also have kind of a closer connection to how their health can impact those goals based on just being familiar with their friends or family members who have had diabetes and talking to them about some of that extra hassles, like maybe packing insulin on an airplane, or how neuropathy may affect walking during vacation, or joint pain and those sorts of things. So they've got this real connection. They've seen in real life how these things can impact their overall health and what they want to do with their retirement, that sort of thing. They also, a lot of times, want to avoid more medications. So that is another motivator, another thing that comes up in conversations quite a bit, is just wishing to avoid adding to that list. And I'd say with the activity goals throughout, our sessions are really designed to meet people where they're at, whether that's increasing their walking or increasing what they're doing around the house. People are encouraged to meet a moderate pace of activity. So it's really individualized, and we do see people make progress throughout the program. A couple of people come to mind. I had one person who our program had just started for that group and had a hospital stay. She was actually able to join into our sessions through telehealth because that was an option at the time. It was not expected of her to do that from the hospital, but she chose to go ahead and continue showing up. And now, instead of walking, which was maybe her goal to begin with, she has been focusing more on PT and making sure she's doing those PT exercises while at home, and even pushing herself to do like a walk around the house every hour, you know, setting a timer every hour to get up and move a little bit, or to do more house chores. So, you know, that's one end. On another end, I have somebody in a group who originally, during our one-on-one session, talked about she felt like her activity level was fine because she was doing a lot around the house already. She rarely sat down, those sorts of things, but she wasn't doing any higher intensity exercise. So those were the minutes she was reporting at the beginning, a few weeks of our program together. And now that we're several months in, she's committed to like 30 minutes walking every day. And then as soon as the weather got cold, she started doing YouTube videos, and she sent me some of these videos of the exercises she's doing, and they're pretty intense. So it's just funny to see how people's mindset around activity really can change throughout the program, and how that group interaction, hearing what others in the group are doing for activity, really helps them reframe their mindset. Oh, I could be doing more. I could be using my time a little bit differently at home. So that's been really great to see with that Medicare population specifically. Within the working population, they can do really well with the program too. But generally, the people who do the best as that like 40 to 64 age group or even younger are going to be the people who really have that prediabetes lab value, or have a really strong family history or connection to type 2 diabetes, because they just tend to take it a little more seriously. They feel that connection. They understand when we're talking about how blood sugars impact different things in their life. They get that. So The other thing with the working population is, can they commit to that 1 hour weekly session? We meet 1 hour per week for the first 4 months, and then we move into every other week sessions, and then we move into monthly. So do they have the flexibility in their job to be able to attend those sessions? Because as Thyra said, those who attend the sessions regularly, and the more sessions they attend, the better they do at the program. So we are always meeting with these people one-on-one before they join the program, and we're kind of getting a feel for, can they make that commitment? Are they somebody who recognizes what prediabetes means? Of course, we're doing some education during that session too, and just to see if they're a good fit. In that initial prediabetes session, I'll tell you a little more about that. If they are not a good fit for the program, or they just decide that they don't want to continue with the full year-long program, they do have an opportunity to continue following up one-on-one at their own pace as well, outside of the program. This is also really great for people who enjoy group interaction. Some people know that they hate group settings. That's okay. We can do one-on-one sessions if needed. That would just be separate thing, but people who enjoy group interaction really do well with this, because our groups are really connected with each other. They get really close. You're with the same 10 people all year long, so we really get to know each other throughout. Every time a session ends, I'm kind of sad to see them go, because we just spent a year together. And the more connected the group is, the more successful that group is. I would say don't discount people that you feel are maybe quieter, because I've had some quiet people join and they still get a lot out of the group and they open up throughout the year. So don't automatically make that assumption. But if they're outright saying, I'm not a group person, generally they're not a group person. So we always offer it to everybody who is referred to us for prediabetes. I do have a few sort of case studies or stories from some of our past participants that I wanted to share, just because we've gone through the data, but I think this really highlights how much people's lives are impacted by the program when they are making these changes. So we've had an 86-year-old woman who, from a data perspective, dropped her A1C from 6.1 to 5.8% throughout the program. She was able to meet and maintain that 5% weight loss goal. She's been through the original program and is in the second year. And what made her kind of special was she partially through the program invested in an exercise bike. She actually had some money saved for a vacation she was planning to take, and then COVID kind of threw that plan out the door. So she took that money and invested in an exercise bike and was using it all the time. So that was really an exciting thing. And also with her, one of her main goals for starting the program was not just to prevent diabetes, it was actually that she would love to adopt a small dog to have, but she was concerned about her fall risk if she had to walk this dog. Throughout the program, she felt so confident in how she had improved her activity level that she actually adopted 2 small dogs and was walking them often as well. So that was something we really celebrated in the program. I had another woman in a program whose A1C went from 6.4 down to 5.3% after 2 years in the Medicare program. And it was a gradual decrease. We went from, I think, 6.4 down to 5.7, and then she had a 5.5, and then 5.3 with her most recent. So huge change from right at the top end of that prediabetes range down to well under the prediabetes range. She also met and maintained that 5% weight loss goal throughout. And I admired this person because she was able to find quick and simple ways to incorporate healthy food into her lifestyle. Cooking extravagant meals was not something she was interested in doing. And because of the flexibility in our food goals for people, she was really able to just have several go-to meals that were quick and easy for her and her husband to create at home. So that was pretty exciting to see. Thyra has a story she would like to share as well.
Yeah, so my story is about a husband and wife who joined the program together, and I wasn't really sure if that was a good idea or not, but they worked hard individually, and then they also, one of the interesting things was that they found a good way to support each other, and I think that was one of the beauties of it, was that they had to sort of figure that out, because they both needed different things, and they had to figure that sort of communication out and how to help each other and not be judgmental of each other when they had oopses and struggles. So that was really actually pretty cool to see in action over the course of the year that they did the program. They were working people, so they had jobs and they were balancing a lot of things while they did the program. The other thing was, because they were probably in their 50s, I would say. The husband, I think he still thought he was 30 maybe, and he took the activity challenge very seriously, but he forgot that he wasn't 30, and so he did a little too much, and he actually injured himself, and so then that slowed everything way down, and that was very frustrating for him. So it was a good lesson that, sometimes we think I can still do those things that I did when I was young, but really it's better to go slow and moderately increase our activity. But the group was so supportive of both of them and really helped them along. And they ended up with having a 7.5 and a 6.8% weight loss. And both of them had fasting blood glucose levels that decreased as well. So that was a good case of a couple who was able to make big changes and sustain them as well. So.
All right, and the last one that I wanted to talk about was a man that joined the program because he actually was just attending the prediabetes session that his wife was scheduled for. And in that discussion, found out that he also had prediabetes. So they actually joined together as well. But of course, when you come to as a support person and not necessarily thinking this is for you, we didn't have quite as much buy-in from him at the beginning. So it was really cool. He actually did really well throughout the program. A1C was reduced, and the 5% weight loss goal was met. But this was somebody who had a strong liking for Dr. Pepper, big soda drinker, and completely quits drinking soda. And I feel like that is just a huge achievement as a dietitian. That's something people struggle with quite a bit. But he completely quit soda and switched to cherry bubbly water. So found something similar but much healthier to move into, and also was very dedicated to increasing his activity throughout. Was also somebody who biked indoors and started walking more, and he and his wife really enjoyed Frisbee golf. His wife ended up joining a Frisbee golf tournament throughout the program, and one of their long-term goals was to get back to something they had done when they were younger, and every time they were on vacation, seeking out a Frisbee golf course to do together on vacation. So just some different ways that lives are being impacted outside of just those black and white health goals that we're usually looking at. As far as those health goals go, this program is focused on prediabetes, but many of our participants are also coming back and reporting that they've seen improved cholesterol levels, improved blood pressure levels, that they've been able to reduce some of those medications, and that liver enzyme levels are improving as well. So it really is impacting a lot of different aspects of health, even though we're mostly focused on prediabetes. So how can you get your patients into the program? And this is the same process for the Medicare program or the diabetes prevention program. We use the same referral. You can go into Epic if you use Epic and just use the REF20 code, which is for our diabetes education, and just indicate on there that they have prediabetes. You can choose what type of diabetes they have, and prediabetes is an option. If you need to fax in a referral, you can, of course, fax, and we have our fax number listed at the end of the presentation as well. From there, we will call the patient and schedule them for a one-on-one appointment. And this is going to be a one-on-one appointment with a dietitian who is sort of screening them to see if they're a good fit for the diabetes prevention program, but we're also completing a nutrition counseling appointment during that time. So they're also getting some information about like carbohydrate counting and the plate method, just to kind of give them a good start as they enter the program. And that way everybody's kind of on the same page as what to expect when we get to the food stuff throughout the program. If the patient decides that they want to join the program, I told you we tell everybody about the program. They get to kind of decide if they're a good fit along with us kind of feeling them out with it. But if they decide to do the program, then we will explain insurance coverage to them, what that might look like, and also tell them when the next groups are starting. We usually are starting groups every 3 to 4 months, so there's always a wait list. And as soon as we have at least 10 people who are ready to go, which is about every 3 months, we're starting a new group. And those are always at different times of the day. These are our current coaches. So we've got Thyra, myself, and Jolene, so a mix of nurses and dietitians. We also have some other coaches as well who are not currently doing programs, but are also there to support us throughout this year-long program. And if you would like to contact us for any more information, here is our phone number and our email addresses for Thyra and myself. And then, of course, our location, which hopefully you know, we're here at Mary Greeley on the 3rd floor of the North Addition. Right, and then these are our references, and we are happy to take any questions.
All right, so it looks like at this point we don't have any questions, so we thank you for attending. And if you do have questions, you can always contact Liz or I at our contact information. Thank you. Bye-bye.